Good evening, ladies and gentlemen. We're going to go ahead and get started in the sake of time. So thank you so much for coming to our community event for cancer patients in our Stanford community. I almost forgot where I was. Tonight we have registered dietitian Raymond Palko, who's going to be talking to us about organic versus conventional foods in cancer. So without further ado, please, Ray. Thank you.
Good evening, everybody. Majority all brand new faces to me out here, one that I know. Again, my name is Ray. I'm one of the dietitians over at the Cancer Center at Stanford. We work there with everyone from our patients who are newly diagnosed and entering into treatment, people currently in treatment and in survivorship as well. Just trying to help them tailor their nutrition for whether it's during treatment to manage the side effects of the disease or the treatment and maximize their outcomes during treatment, and then even in survivorship, trying to guide people forward. It's a very interesting or important point to think about in survivorship is that cancer is not always one and done. So anyone who's a cancer survivor continuing to follow the same recommendations and guidelines that we put out for cancer prevention is an important thing as you move forward with your life. So today's talk, Darla and Esther had asked me a while back if I'd be interested in doing a presentation. I said, absolutely. I asked them what topic, and they said, I don't know, what topic do you want to do? And then I had to stop and think around about it for a while. But I thought that this is something that's fairly timely, and a lot of people are really maybe have confusion or misconceptions, or they're not sure about organic food and what does that mean. And so everything today will be through that lens of organic food as it relates to cancer risk. We'll be exploring that. So outline of what we're going to discuss. So first, important to define organic, right? Because we might not even know what that means. And just kind of have an idea of why individuals are choosing organic food versus conventional. Then we'll get to the kind of the big main question, is organic food healthier or not? Before I even go into everything, I'm just curious, show of hands, who thinks that organic food is healthier than non-organic food? All right, so we've got a couple firm, and we've got a couple up in the air, and we've got a couple no votes. Okay, yeah. So we'll look and we will try our darndest to answer that question, and then really want to transition into the relationship to organic foods and cancer risk, and also be looking at what other sort of things, regardless of whether the food is organic or not, what are the other things that we really ought to be doing to decrease cancer risk. And I think there's probably going to be lots of time for question and answer as well. But you never know, I might ramble on. So these, I'm going to read these slides word for word just to get the point out of exactly what is organic. And this is from the United States Department of Agriculture National Organic Program. So the USDA is the body in the United States that certifies food. It's not even that they certify the food, they certify the specific farms where the food is produced as being organic or not. And it varies from country to country. So that's something when you go to the supermarket and you end up buying an organic apple from Chile, it probably, I didn't look up all these other 250 countries in the world, their organic standards, but probably pretty similar. But this is what it is if you see USDA organic. Organic is a labeling term for food or other agricultural products that have been produced using cultural, biological, and mechanical practices that support the cycling of on-farm resources, promote ecological balance, and conserve biodiversity in accordance with the USDA organic regulations. This means that organic operations must maintain or enhance soil and water quality while also conserving wetlands, woodlands, and wildlife. Synthetic fertilizers, sewage sludge, irradiation, and genetic engineering may not be used. So as you see there in the definition, it is largely more of an environmental emphasis that drives the USDA organic program. And I believe that was sort of the original intent, was farming that would be kinder and more gentler to the planet. And the health aspects of it, I think, might have been secondary, and where now more and more people are questioning, is this going to be better for my health? Or if it's gentler to the planet, surely it must be gentler to my body. So, yeah.
There's no mention of pesticides in it.
So the pesticides are under the, that is a good, I think that they're lumping that in with the synthetic fertilizers. Yeah, and so, but pesticide, well, it couldn't just be a broad statement, no pesticides, because there are organic pesticides. So it would be, that would be falling under that synthetic category. Yeah.
What does CA mean when it says organic versus CA foods?
CA?
On the first slide, it said organic and CA risk.
Cancer risk. CA is an abbreviation for cancer. Wherever you see that, it's talking about cancer. Yeah. So why do people choose organic? One, there is that, I think a lot of it goes to that first point, is that perceived health benefit. A lot of people we have this concept, this idea in our mind, organic food is healthier than conventional food. That's one reason. Values can be another reason. So that's the environmental piece. You feel that you'd rather be purchasing food that is gentler to the planet, kinder to our environment. And then also, who are the other people inhabiting the planet with us? There are the farm workers. So that's a big driving point for a lot of people, is they know that while food grows on trees, it takes humans to get it from trees to you and to your plate. So for a lot of consumers, it's really important that the farm workers are having the best possible environment, minimizing the amount of some of these pesticides and things that they're using. And then also the animal welfare as well, if we're looking at our livestock that we're, cattle, poultry and such, their welfare. In the organic models tends to be that there's a lot more free range, grass-fed, rather than feedlot and cage-fed. And then there's the safety concerns as well, the pesticide residues, the concern that in non-organic produce there will be higher values of pesticide residue remaining, and what might that effect on our body be. Another concern also is antibiotics. That would be backing into the livestock. And in organic livestock, you're not seeing the use of antibiotics that you will in conventional. And there's a big level of concern around this trickle down of antibiotics. They're basically using antibiotics to either promote growth in livestock or just as a measure to prevent them from getting infections, to the point where they can then get the livestock from the farm to slaughter and into the plates. But all those antibiotics are building up in the tissue of the animal, and then later that gets passed on to us. And then surely everyone's familiar with the concept of antibiotic resistance. This is a legitimate big problem that we're seeing, where more and more, I'm going to say the wrong thing, antibiotic bacteria. More and more bacteria are becoming resistant to conventional antibiotics that we have. And there's, I'm not an epidemiologist, I can't figure this out, but there is the theory that what happens one day when we have bugs growing that we don't have enough antibiotics to kill. So that's another reason that people are choosing organic, is not contributing to that.
So I've got a quick question. I differentiate between political issues, which I regard as, regulations appropriately directed to the non-use of dangerous pesticides, and what I can do as an individual. I can be politically active, but some of these larger issues, I just don't know what I can do as an individual. I guess I'm here to figure out what I can do as an individual.
Okay. Yeah. So, question about just what specifically you can do as an individual. I'm not sure exactly how to fully answer that question right now. I feel like it was a little broad and open.
So, a quick question: is it worth paying double to buy organic, or am I okay not doing that? Forgetting the social
we'll get there.
And political issue.
We'll get there.
Yeah. Okay.
Hold. All right. So, and here we are to the next slide, looking at, is organic healthier or not? We've had a few more people join the room since before when I asked, but I kind of did a open show of hands to see, is organic food healthier than non-organic food? And it was about a split consensus. We had a couple that absolutely said yes, a couple that were in the middle, and a couple no vote. The true answer about, is organic healthy or not, if anybody tells you an absolute yes or no, I think that they're being a little bit absolutist, and I don't think they're being 100% true with that. I think the answer is that we don't really know. So I put up the information, and later in the resources, it has the journals and the DOIs and things where you can look at some of these things in depth online yourself if you'd like. But I put up a couple research points that show a mixed picture. What I'll first say is that researching anything related to nutrition is extremely difficult because of the extensive number of variables that come into play. So there's, I can't think of another example, but researching something else, do traffic, is traffic better if there's 2 stop signs instead of 1? Or so forth, is kind of the direct thing to research. But when you're looking at the human body and intake of nutrients, there's so many other variables within your diet alone, and then your own individual biochemistry, your health status, medications that you may be taking, and so forth. So it's a really challenging sort of thing to study anything related to diet, and then to specifically pit an organic production style of the food versus a conventional style is really, again, challenging. And the way that we know, and one small study that someone does can't really answer that question. The way that we learn these things, and eventually, we go from smaller studies to individual studies. The gold standard is going to be a randomized controlled clinical trial. Think of the feasibility of me splitting the room down the middle and me being able to feed all of you every single thing you eat every day, but half of you get organic and the other half get conventional, but you don't know the difference. Just imagine us trying to do that in this small room of about 20, and that's not enough data points to really tell you the truth. So the way researchers were trying to answer it even further was scouring out published literature, research that people have done, and trying to build them together into what's called a meta-analysis. So then you have this issue. These different meta-analyses have hundreds of studies involved, and you have hundreds of different researchers that did everything differently, but you're trying to tie it all together into one neat package to give you an answer. So what we've seen, and it's a mixed picture, researchers at Stanford about 5 years ago set out to do this, to build this meta-analysis to get an idea, is organic food better for the human body than conventional? Their conclusion said that published literature available lacked a strong amount of evidence, but they did note that choosing organic may reduce exposure to pesticide residue and antibiotic-resistant bacteria. So that's 2 of those points that we talked about, looking to reduce our exposure to pesticides and society's long-term exposure to antibiotics and resistant bacteria. The European Parliament, just for diversity, we're going across the pond now, they, in 2016, so just last year, they did a large study where they did kind of a meta-analysis of the research themselves, and their kind of overall noting was that there was a lack of evidence still to prompt to say organic better than conventional. And I will put the caveat out there that, again, a lack of published research evidence does not mean, okay, it's absolutely not true and there's no need. It's just that we don't have any firm footing to stand on to say, absolutely, you should be doing this. And then in the British Journal of Nutrition, in 2014, they put out a meta-analysis there again that they grouped all this information together, and they did find on average organic crops having higher concentrations of antioxidants versus conventional crops. So that would be definitely something that would tilt the balance to say organic would be healthier for the human body. Across the board, all of these analyses are noting that as far as macronutrients, carbohydrates, fat, and protein are major nutrients that provide energy to the body. There's no difference showing up there between organic and conventional foods. But those micronutrients like vitamins, minerals, antioxidants, and things are where they're starting to see some differences. So antioxidants specifically, in considering cancer risk, antioxidants in our food, that's a large driver why our big recommendation you'll see later on for a cancer prevention style diet is predominantly plant-based foods with high emphasis on lots of vegetables and fruits. So again, that British Journal of Nutrition meta-analyses points towards saying maybe this is a better choice. In 2016, again, they did a review on dairy products and found that organic bovine or organic cow's milk had a more desirable fatty acid composition than conventional milk. But then it had a little bit mixed on the micronutrients. It had more iron and vitamin E, but less iodine and selenium. So kind of a mixed picture there. But again, sort of pointing us towards saying that these organic foods could be a better choice. Question?
Yeah, can you define the antioxidants?
Yeah, so antioxidants are substances in food, primarily you find in plant food, where so free radicals are a substance that exists naturally in the body, and production can be increased due to stress, health, illness, issue, environmental contaminants, and the antioxidants basically, and these free radicals can damage our cells throughout our body. And antioxidants basically just, they're no longer free radicals. They lump onto them and wipe them away to a point where they're not damaging to the body. Yeah. I hope that made sense. There's one of those things where it's like in my brain, I've known it so long that I sort of forget how to explain it.
Well, I thought, and I might be totally wrong, that antioxidants were supposed to be good for you.
Yes, exactly. So antioxidants, well, and again, good for you. Good and bad really muddies the water with things. Antioxidants, we do want to be getting a large amount through natural whole foods in the diet. So seeing again from that one review that organic crops had higher concentrations of antioxidants, that would be something that we would look at as a benefit to our health. Absolutely. Yeah.
So where do these free radicals come from in the first place?
You know, again, that's one of those things that it's like I learned it so long ago, how to really, they're naturally produced within the body, and it's a response to different stressors or things, again, environmental contaminants, illness, and so forth. And it's something that's naturally in the body, and it's not normally an issue, but in our modern day lifestyle, excess production is associated with different chronic disease risks, with cancer risks, and so forth. Yeah. All right. So looking more at organic and the cancer risk, the bulk of information that I go off of and that I'm disseminating to patients and individuals about diet and cancer risk comes from the American Institute for Cancer Research. You'll see, and I'll have more of their infographics throughout, so their names kind of on your slides. That's a great organization to look through just as an individual for information that you're seeking on your own. A really, really wonderful organization that basically what they do, all this research and literature that's out there, they work on putting it together and synthesizing to be able to provide strong evidence-based guidelines to individuals and what they can do for their risk.
That's AICR?
Yes, AICR. So basically their quotes about organic and cancer risk were really kind of mum. They didn't have a lot to say. They say there's currently no strong evidence to show that organic foods offer added protection against cancer compared to conventionally grown produce. But here's the kicker sentence. Further research is required. They can't emphatically say, oh, it doesn't matter either which way. They're kind of like, it would be good to research more. And also, so genetic modification, that's a genetically modified organisms, that's a whole nother ball of wax that I'm not really going to get into today because that could be its own presentation. But the link between genetically modified organisms, or GMOs as they're commonly called, and organic is that anything that is USDA organic cannot be GMO. So that's another reason. I could have thrown that in that initial slide. There are a lot of people that they don't mind worker health, they don't mind the environment, but they're freaked out about eating a food that's been genetically tinkered with. So buying organic food is a protection against GMO. But AICR also said genetically modified foods are produced from organisms that have had specific changes introduced into their DNA using genetic engineering. There's currently insufficient evidence to conclude that genetically modified foods affect cancer risk.
But I totally have confidence in what you're saying, absolutely, 100%. You realize, of course, that what you're saying is extremely and diametrically opposed to a lot of disinformation that's circulating. I'm a cancer patient that's circulating around in the internet and every place else, practically convincing cancer patients that we caused our own cancer by eating improperly. So
Yes.
it's nice to,
Yeah, and so
to know the actual facts.
yeah, and with regard to that, I will say that the internet's greatest strength is its greatest weakness, and that is free and open access to anyone. to have a platform to put out what they're saying. So there is absolutely a lot of, there's some really well-intentioned misinformation that exists and is floating around relating to any number of, to cancer and risk through diet or lifestyle or activity. I think the bulk of it's probably really well-intentioned misinformation. And then there's some stuff that's just so off the rails that I read it and I left scratching my head. So, yeah. But more in the angle and in the support of organics, this was a fascinating. So this whole exercise in doing research for this presentation, I will tell you in full disclosure, I'm someone that for years now I've said, I'm not going to pay a premium for organic produce. So I've been in California for 5 years, just a little over 5 years. I moved out here for my internship to become a dietitian at UCSF Medical Center, and I was earning $8 an hour, and which is one of the few dietitian internships in the country that you actually earn anything. The bulk of them, you're paying tuition to intern. So I moved to San Francisco right as housing was really getting crazy, earning $8 an hour, and I'm not going to pay a premium for organic because I'm not sure how I'm paying rent next month. So that's always been kind of where I've been at for the past few years. And then, I'm reading through some of these things. I'm like, well, maybe it would make sense now that, I'm in a slightly better position. Maybe it would make sense to buy more organic because I'm reading these different things. And ultimately, the concern about cancer risk or other chronic disease risk and pesticides specifically, some which are known carcinogens, it's a really hard thing to pinpoint. So some of these chemicals can be known carcinogens, and what I'm seeing from this is coming from this President's Cancer Panel, 2008 and 2009. They did an annual report on reducing environmental cancer risks. So again, talking about things you can do as an individual. And what they noted was that there's certain things where we know there are risks, and there's measurable ways to say that you can only take so much before the risk becomes more real. And I'll use an example of radiation. So specifically, and this is something that ties a lot to oncology, so many different cancers, we use radiation as one of our treatment modalities. And specifically, I work a lot with patients with oral head and neck cancers. And the oncologists, they'll keep a track of how much radiation exposure the patient has had. And they've got a certain amount, because it might be that they got one course of treatment. An oral head and neck cancer usually gets about 6 weeks of radiation. They might get that treatment, but then there's a recurrence, or then there's a secondary cancer, or something else happening years down the line. So the oncologist is kind of keeping a ticker, if you will, of how much radiation exposure have they had. And if radiation still seems like something that might be viable, but they know that there's been enough or borderline too much already, then they have to look at a different treatment modality like chemotherapy or immunotherapy because the lifetime radiation exposure is too high that it's presenting other risks. So that's an area where we have at least some way to monitor that. Of course, we don't have a ticker that's checking every time we get dental x-rays or every time we go through the x-ray machine at the airport. So total radiation, we don't really know. We have no way to measure or monitor your exposure to these pesticides and to know exactly how much you're having. So in the report, a lot of the scientists that put it together, they were saying, well, while this chemical in this dose is considered safe as a pesticide, look around the room. We're all different body sizes. We all have different activity levels and different appetites. We all eat different amounts. There's no way to really know, so I'm eating 5 apples, but you're only eating 2. What's the risk level exposure there? There really isn't a way to quantify that. So that's where a lot of people feel on the air of caution or safety. They're trying to choose more organic. And so what came out of the panel's report, their recommendations, they said that it would be prudent to choose organic whenever possible. When you're getting conventional produce, to wash things thoroughly and to make sure that you're eliminating as much pesticide residue as possible. They're also advising choosing free-range meats raised without antibiotics. And then these other things, these kind of go away from the organic specifically, but minimizing consumption of processed, charred, and well-done meats, storing and carrying food in stainless steel or glass rather than plastic, and not microwaving food in plastic containers. These are other ways that might be leading to and causing some cancer risks.
It says choose free-range meat raised without antibiotics. In one sense, it sounds like antibiotics are good, and in another sense, not so good.
You're confusing antibiotics and antioxidants.
Oh,
Yeah.
I'm sorry.
Yeah.
Thank you.
Antioxidants, when they're coming from your food, good. Antibiotics, when you have an infection that you need them for to cure, good. When you're getting superfluous amounts, bad.
Thank you for pointing that out.
No problem.
So using the microwave too, it sounds like it's okay to heat food in the microwave or cook food in the microwave.
Yeah, so a question about microwaves. That was something I can actually vividly remember to this day, and it was well over, oh gosh, I'm older than I think. It's well over 20 years. How old am I? It was probably like 25 years ago or so. But I can vividly remember my sister saying once in the kitchen back home, she said, in 20 years, we're all going to have stomach cancer because everyone's microwaving their food. You know, I grew up in a family that we didn't have a microwave until I think I was in college. And my sister was wrong. That's been debunked. Microwaves are not a cause. There's not any proof or research anywhere to show that microwaves are a cancer cause. Some of the plastic containers that we carry our food in do have chemicals that have been associated with cancer risk, and the microwaving action can cause some of those chemicals to leach out into foods. So it is recommended, yeah, if it's a plastic that you, BPA, and I don't even know how to pronounce this word, phthalate. Esther, you thought you were going to mispronounce my last name. That is a word that we can mispronounce. Those are chemicals that have been associated with a number of different health risks, whether cancer risk or endocrine disruption. So, not microwaving in those plastic containers and leaching into the food.
Can you list some of the processed foods? Like, are we talking like hot dogs, cold cuts, or?
Yes, I had a question about that processed and listing that. Yeah, so that's specifically referring to processed meats. Processed meats, we would consider anything that is salted, cured, smoked. So exactly like the things you suggested: hot dogs, cold cuts, bacon, sausages. The AICR in their research reports on colorectal cancer has actually identified those as kind of big risks for colorectal cancer. They definitely can increase your risk with regular consumption, so it is advised to avoid those.
So what about like nitrate-free bacon?
Yes.
Different?
Yeah, so a great question about is nitrate-free bacon better than, or let's see, I said don't say good and bad, and here I am. Is nitrate-free bacon different than processed meats with nitrates? And that's one where it's going to say, not really sure, maybe probably incrementally better to some degree. But again, when the research was kind of conducted as an umbrella of all processed meats, and there wasn't any specifically to tease out, you know, organic processed meat versus non, or nitrate-free processed meat versus non. So the guidance is still that you want to be avoiding processed meats and not having them as a regular part of your diet. Yeah.
So on your slide is avoid well-done meats. So you don't want the chicken overcooked.
So that's a little bit tricky there. Your meats, you want to cook them up to the safe minimal internal temperatures so that you're not running the risk of any foodborne infection from there. But really what we're seeing is like it's more specifically with grilled meats when things get to the point of being charred. There are chemical conversions in the proteins that are a substance called heterocyclic amines. These chemical substances are being produced through the excess high heating that are associated with increasing some cancer risk. So you don't want to eat your chicken rare by any means. You want to get it cooked, but you don't want to be charring it to the point where it's unrecognizable. And actually, if you go onto the AICR website, they have a really great blog article on there about what they call safer grilling, or grilling techniques to reduce cancer risk. Different things you can do, like pre-cooking your meats, maybe in the oven, so that it's a short time on the grill, just to get a little bit of that kind of smoky flavor and crispness, but not as much heavy char. Marinating your meats, and they even have some different recipes on there in like herb and spice and fruit juice marinades that so here comes the antioxidants again. The high amount of antioxidants in the different herbs and spices that you're marinating in can help to prevent some of that conversion from your nutritious high protein meat to cancer promoting risk chemicals. So that's a really great thing that you can go and look onto their website.
What about washing produce? What constitutes effective washing?
Yeah, that's a great question. What constitutes effective washing on the produce? Is basically the way, and I talk about this a lot actually with our stem cell transplant patients. They've got to scrub their produce to make sure they're not getting a foodborne infection. Basically, I like to think of it as you wash it to as well as it can handle, what it can hold up to, right? Because you don't want to scrub a lettuce leaf and then all you have is lettuce mush on your scrub brush and then you have no salad. So something delicate and tender like lettuce leaves or herbs and spices, a great method is to maybe first soak them in a bowl of cool water. And that's kind of helping debris, pesticide residues, maybe any little insect friends that followed along from the farm. It's kind of helping them get away, and then you're soaking it in water, and you're maybe like a gentle sort of massage to whirl things around in there, and then putting it into a colander and rinsing it well under the sink. That's kind of your really delicate things. The other end of the spectrum, you have a melon, a winter squash, a potato, something hard like that. That under running water, a scrub brush can help. You ideally, bacteria and pesticide, you can't see that, but if you're removing visible signs of debris, that's a good key that you're washing well and getting them removed. Yeah, good question.
So I've got a follow-up question along that same line. There are for sale in grocery stores so-called vegetable and fruit washing solutions. You spray it on the fruit, you rinse it off with water, and it's supposed to be wonderful. Do you have any opinions on those, whether they're effective or not effective, or?
Yeah, so the question about the commercially available produce washes, I think that they're effective, but I don't think that they have a benefit to you over running water and a scrub brush. I think the bulk of the action, and again, I'm not what's someone that studies bacteria, a bacteriologist? I'm not an infectious disease person, but my understanding is the bulk of the action, just like when washing our hands really, is coming more from the effect of water washing things away and the vigorous action. So I think that is enough, whatever the medium, whether it's water, a lot of people do vinegar and water, they mix that together. That's kind of a folk remedy that they've heard that's really good for cleaning, but it's much more about the actual physical motion of the water rushing any debris and things away. Yeah.
Are you going to talk about
think
cooking
it's
your
funny
utensils? Like people mention aluminum is not good for us. Cooking utensils,
Like
utensil,
pans,
Yeah.
pots.
the material.
Yeah, so the question about aluminum cooking pans or utensils, and I'm not really familiar with any negative health detriment to using aluminum utensils. So I will not be discussing. Oh, so now you're talking about like Teflon and nonstick. Honestly, not prepared to discuss that. Not really. I've heard things, you shouldn't use nonstick things, or know that they're okay. Not really prepared to talk on that. Sorry. Darla, did you still have a question? It got, okay, it was doubled up. Perfect. All right. Yeah, let's continuing to kind of delve in and look at some of these different aspects of risk reduction. And I alluded to it in the beginning about these fruits and vegetables being the kind of the cornerstone of cancer risk prevention, or cancer risk prevention. Sorry, it's been a long day. I'm stumbling over my words. So basically for anyone who is interested in reducing their cancer risk, or cancer survivors to reduce their risk of a secondary cancer or recurrence, the dietary cornerstones we advocate for are plant-based diet. Now, that doesn't mean that everybody has to become a vegetarian or a vegan. What we mean by based is the basis of the diet. So I've got this great infographic here that sort of gives you an idea of what it would look like. And think about every time you're sitting down to a meal, is it 2/3 or more coming from plant foods? And I always throw out the caveat, and I tell people whole plant foods. And when I say whole plant foods, I don't mean plant foods purchased from Whole Foods Market / Amazon. I mean whole plant foods that look like these, that look like plants. And where I'm going with that, soda, French fries, potato chips, these are all from plants. These aren't animal foods. They come from plants. Do you think that to reduce your cancer risk, you should have 2/3 of your plate soda, French fries, and potato chips? No. You want actual whole things. Like a broccoli looks like a tree. Like that's a good sign. If it looks like something in nature, it's probably a good sign. So plant foods, vegetables, fruits, whole grains, nuts and seeds, beans and legumes, herbs and spices. These are the kind of foods that we want to be eating a lot of. They've got a lot of these antioxidants, phytochemicals, which is just a fancy word for plant chemical. It doesn't really tell you anything by the name. Vitamins, minerals, antioxidants, we already said. They've got a lot of these properties, fiber as well, that are it's really well associated with decreasing cancer risk through different physiological functions in the body. So we really want to consider that as our bulk of our diet. You want to, this other little square here we're seeing, and we talked about that before, reducing processed meat. So red meats, processed meats, we want to be reducing or avoiding. Red meat would be any beef, pork, or lamb. I'm sure probably everyone has heard this before. Red meat causes cancer. To say anything causes it, it's not always a direct relationship. High amounts of red meat are associated with different gastric and colorectal cancer risks. The guidance is that everybody eats 18 ounces a week or less. So consider that roughly, if you're not sure, like ounces in meat, a deck of playing cards that size, or like an average adult's palm, that looks like about 3 ounces. So consider that if you just absolutely loved beef, but you had a family history of colorectal cancer risk, and you're like, well, I really shouldn't be eating this because this might cause this. 6 days out of the week, a 3-ounce portion, and you're right there at that threshold. So common portion sizes and things, and what I wind up telling people is once or twice a week to have red meat, you're not likely putting yourself at extra risk. But the type of people that eat red meat for 3 meals a day, 7 days a week, you are putting yourself at increased risk. So it kind of helps illustrate that point. The processed meats, again, they don't have any guidance on specific limits or amounts. The guidance is to avoid these type of things. So again, when people are, a couple of years ago when the World Health Organization adopted these standards, it was Bacon Gate. All of a sudden everyone's saying, oh no, I can't eat bacon and bacon's gonna kill me. And you go out to brunch once a month with your friends and you have some bacon with your brunch, not really a big deal. Eating bacon 3 meals a day, 7 days a week, or even 4 days a week, not a good idea. So, again, there's not a hard line there to say, but reducing is a good idea. Alcohol, it is advised to drink with moderation or not at all. Moderation means something different to everybody.
I
Yeah.
live in California, so.
So moderation, the definition of moderation when it comes to alcohol, sorry ladies, but for women it's 1 drink a day, and a drink is considered a standard size. So that's the other thing too, this portion distortion that we live in, it used to be that we had things in kind of moderate amounts, where now it's like, oh, well, I just went to the casino and they poured like a yard glass full of beer, so that was a drink, right? And it's like, not really. So a drink is considered 12 ounces of beer. I always forget, is it 4 or 5 ounces of wine? Somewhere in that neighborhood. A realistic, everybody says 5, and then I'm seeing 4 in the back, and then I heard 8. But again, nothing in life is so absolute that we're like stuck on these numbers, but it's the concept of it, right? So 12-ounce beer, a 4-ounce wine, or 1.5 ounces of spirits, that's considered a standard drink. So for women, again, sorry, moderation is considered 1 a day. For men, it's considered 2. But sorry to everybody, the big bugaboo is that you don't get to bank them. You don't get to Monday through Friday not drink, and then Saturday night go out with your friends and have 7 or 14 and still be under that moderation umbrella. So important thing to consider, and I think a lot of people are not necessarily aware of the relationship of alcohol to cancer risk, but really anywhere the alcohol touches, oral cancers, esophageal, down into the GI tract, there is some risk of excess alcohol consumption and cancer. Salt as well, it's another thing where people don't really think about a lot. We're so concerned about salt for our heart health, which is really important, but excess sodium consumption is associated with some risk of gastric cancer as well. Other prevention things, and I'm leaving some of them for later. This only affects some of us, and I'm not sure, looking around the room, I don't know how many women plan to have another child, but breastfeeding is productive against breast cancer risk for women. So that's something that, even if there's anyone younger in your life that might be having kids, another good reason, there's a million good reasons to breastfeed. That's a whole nother topic. Then this bullet here about supplements. So that's another, talking about that misinformation and things floating around. The dietary supplement industry is a huge I don't know if it's billions or millions of dollar industry. There's really not good evidence anywhere that we should be taking much, if any, of the supplements that we take. Vitamin D is an outlier that most people are deficient in vitamin D, and it's really hard to get it through the diet. So that's a little bit of an outlier. A general multivitamin, take it or leave it. I'll have some patients that they're going through cancer treatment and they really just cannot eat enough and their weight is suffering, and you might think that a general multivitamin may be a good idea just to at least kind of an insurance policy and tack on, at least you're getting the vitamins and minerals that you need, that you theoretically that you need, but they're much better absorbed through food. You absolutely need them. Will you absorb them all from a multivitamin? Questionably. Through food, much better absorbed. But absolutely, it's not recommended to be doing any type of supplement regimen as a form of cancer prevention. There's no data anywhere that there are supplement regimens. There are absolutely people who will tell you that. You will find those voices out there on the internet. That'll be another day where I can sit down with one of them on 2020 and have a debate, and we can go toe to toe. But that's not recommended for cancer prevention. Then the last bullets that I've kind of been delaying on because they'll go into the next slide: moving more and maintaining a healthy weight. This is one of the biggest things you can do, again, and these are all risk reduction areas, things that are under our control outside of whether the food is organic or not. So physical activity recommendations are to get at least 30 minutes of physical activity 5 days a week for everybody, cancer survivors, people with no history of cancer whatsoever. And that's a really, really important thing, and to try to achieve what's considered a healthy weight status. I love this infographic, and I put this up here. This is listing I think it's 11 different solid cancers. And when I say solid cancers, so solid tumors versus a blood cancer like a leukemia. The 11 different cancers that overweight and obesity are in increased risk for. And I think that that's something they're even saying in their data down here. Only about half of Americans were aware that weight status can be predictive of cancer risk. I don't know if people were aware of that or not in the room, but absolutely overweight and obesity can increase all these different cancer risks. So some of our big things that we're trying to do, again, moving more regularly, getting that physical activity in. But the second bullet point up here, I think, is a really, really important one, because I know for a lot of people, if you are overweight or obese, there can be just kind of sometimes there's almost a feeling of hopelessness I've seen with patients, and they say, I'm trying every single different thing I can to lose weight, and it's impossible. From what I've observed through other individuals, weight loss is very, very challenging. Absolutely. The great thing is that, small weight losses. So someone, overweight would be considered a body mass index, which a body mass index is a comparison of your height and your weight. If your body mass index is 25 to 30 is considered overweight, and anywhere from 30 and above is considered obese. I don't want anyone, whether here in the room or anywhere out in the world or the community, that might be overweight or obese, thinking that they must get themselves to only the normal body mass index, or it's all for nothing, and then giving up trying because they've not been able to get that low. Weight reduction of 10% if overweight or obese has been associated with decreasing cancer risk. So to say that a modest effort, or even actually probably a really darn good effort for a modest result, is absolutely worth it, even if you're not getting to that, quote, perfect body mass index. So that's a really, really important thing for people to be considering.
What do they mean by calorie balance?
I'll get there.
Oh, I've got another question. What about dairy? Does that fit into this?
Yeah, as far as cancer risk reduction style diet? Oh, yes, the question was about dairy and cancer risk reduction. That's a great question. So overall, when we're thinking of cancer risk reduction diet, we can lump foods into 3 or maybe even a mysterious 4th category. We can look at things that are protective against cancer risk, like our whole plant foods. We can look at things that are contributing to cancer risk, like our red meat in excess and our processed meats. And then, what should stop at a 3rd category is the no effect, not a protection, not a risk. That would be like fish and seafood, poultry, eggs, not no risk, no protection. And then the mysterious fourth category is that we sort of really have weird and confusing and conflicting information, and that's where we would lump dairy. The AICR, they have a no statement on it because the research hasn't been convincing enough to show anything. With men and prostate cancer risk, it looks like there may, in excesses in certain amounts, be an increase to prostate cancer risk. But that's been, and the effects of prostate cancer risk in diet have been kind of morphing. Even the AICR, they do these update projects every 5 years or so, and there were some things that they thought were protective last 5 years, and then they re-released and they said, oh, it's not as much protection as we thought. So muddy water on dairy and prostate cancer risk. But now, as far as breast cancer risk, they're going so far as to say that there's maybe a protection of both calcium-rich diets and dairy foods, or protection, but they're not really so sort of sure there. So, again, it comes down to in the face of conflicting evidence, and we're not really sure. I tell people moderation is key for everything. If you are drinking a gallon of milk a day, then that's probably too much, and then that's flooding out the room where you could be eating vegetables and fruits. Dairy, we've been sold for the longest time that you must have 3 servings a day to get enough calcium, and I've even run through with dietary analysis software and tried to build a high calcium dairy-free diet without even just relying only on calcium fortified vegan milks. And you can do it. You can get your calcium from other sources. So, but then again, if we consider the patient who is struggling through cancer treatment and really having a tough time eating, then dairy can be a really nutrient-rich food that can actually help you get enough calories in to be able to keep your strength and continue to tolerate treatment. So it's like everything else. There's no silver bullets in food. There's nothing that you can never have, and there's nothing that you must eat every single day, except for vegetables and fruits. You must eat them every day, but you have hundreds of different ones to choose from. So, yeah. But again, in this risk reduction and trying to think about getting people as close towards our healthiest weights as we can be, the activity, and I want to belabor that bullet point one more time, because physical activity can be this scary sort of thought, and especially we live in such an extreme world, right? Nobody just does anything kind of a little bit or halfway or just relaxed and moderate. Everything's intense. So you see like the people going to CrossFit or running their ultra marathons, and we don't have to do that. And honestly, a lot of that activity can be risky towards our health. You might risk an injury. What you need to get out of the physical activity, kind of really 3 sort of major things you're looking for. Are you breathing a little bit heavier than you do when you're just sitting at rest and listening to a presentation? Can you feel the breath going? Is the heart beating a little bit more heavily than it is just at rest and sitting? And depending on the environmental conditions, if it's warmer out or whatnot, is there any sweat? Even just a little, you don't have to be doused in sweat, but there are a few beads of sweat on your forehead. You're doing that, you're getting movement in, and that's beneficial. So the physical activity benefits you in cancer risk in 2 ways. One, in the picture of weight, helping you to stay at a healthier weight. Even 2, even if you are overweight or obese and you start exercising and you're a vigorous exerciser and your weight doesn't change, that physical activity alone reduces cancer risk, regardless of any effect on the weight. So, and then if the weight drops, then it's a double bonus. But the physical activity itself is protective against cancer risk. A lot of that breaks down in the science actually to, cancer cells exist. Cancer cells are basically kind of deformed, deranged cells, not normal. And they exist in a lot of people, but everything in the body is kind of checks and balances. And it's when that they start growing out of control to the point where they form a tumor, that's when you're at cancer risk. These little ones are here, there, these little errant, deranged cells, they're here and there in everybody. Physical activity helps promote, the process is actually, the name is called apoptosis, and I'm probably pronouncing it wrong, but that's kind of programmed cell death. All of our cells turn over in time. When we're exercising more, these little deranged cancerous cells, they die off. They don't get a chance to multiply and form their happy little family, unhappy family, making a tumor. So exercise is protecting you in that regard and also helping with the weight status. We talked about that 10%. And honestly, any exercise, any reduction, if you're overweight or obese, is a great thing. 10% is where a lot of the research starts showing decreasing risks. Calorie balance. So basically, calorie balance is, am I eating as many calories? Am I bringing as many calories in as I'm burning off? That's the goal. And whether the food is organic or not, organic food may be providing us additional cancer protection, but whether it's organic or not, I eat nothing but organic, but your snack was 14 organic apples just as a snack, let alone your meal. You consumed 10,000 calories of organic food when realistically for your age, weight, height, gender, and activity level, you should have been having about 1,800 calories. Whether it's organic or not, those 10,000 calories of organic food are not going to be beneficial to your weight status and then can be relating to increasing cancer risks.
Question.
Yeah.
Don't mention basal cell or dermatology and issues around that. The cancer categories there are more massive tissue issues. But do you have any information about diet, obesity related to basal cell or other, dermatology-related cancers?
Yeah, so the question was about basal cell and other dermatologic cancers. No convincing evidence yet to say that obesity is or overweight is a risk factor for those. But all these other sort of things we're talking about with the plant-heavy diet and moving more and avoiding some of the processed meats, that's all kind of an umbrella for all cancers, helps to provide protection. But specifically to weight status, there isn't an identified research link between weight status and dermatologic cancers.
I've heard stress can be a contributor. My dermatologist has said that.
Yeah.
It can be have some relationship to the outburst of basal cell, et cetera.
Yeah, I'm not familiar with that, with stress being a contributor, but I would say that stress is probably a contributor to everything that's wrong in the world, cancer included. Yeah. So, yeah. Yes?
Is it related to the exercise?
Yes.
I read an article say a cancer cells does not like oxygen. So is the exercise it related to the oxygen? Like if we do exercise in an environment that does not provide us good oxygen, we might just don't exercise in that environment, instead go to outside, have good oxygen, because the cancer cells cannot survive when there's oxygen in the environment. Will control their growing.
Yeah, so the question's about exercise and cancer cells and oxygen. So absolutely, the oxygen, or I think oxidation, or adding oxygen, that is actually some of the method and the ways that some of the cancer treatments work. Like radiation therapy, for example, presenting oxidation to destroy the cancerous cells. Now, I'm not sure what sort of link you're hearing or saying about exercise and oxygen. I mean, when we're exercising, we're breathing more, we're bringing oxygen into our body. That's a good thing.
Because some exercise facility, they close door and then air conditioning, so you don't really get good oxygen breathed in, you just move your muscle. So my question is, if we choose an exercise environment like not good quality, should we just go outdoor to?
Yeah, so okay, now I'm understanding the question better, and thank you for clarifying. Question about exercising indoors versus outdoors. Even if it's an indoor exercise facility, if there wasn't enough oxygen, we'd all be fainting inside. So even with the air conditioner, yeah, and I would say, and even thinking about the quality of the oxygen, we're very fortunate that we live in California. And California, from an environmental standpoint, was a pioneer in reducing car emission standards for reducing car emissions and so forth. So whether is the oxygen better outside versus inside, I don't really know. I don't know that I'm qualified to say that. I think it's much more important to get the movement in and do the exercise. And I'm actually really, really grateful for your question, because it's reminding me back one of my points about exercise that I forgot to say. But to answer your question, I think the movement itself is much more important than whether it's inside in a climate-controlled environment versus outside. But my other thoughts, so I told you about the 3 things you need to get out of exercise: heartbeat, breathing, and sweat.
What's the heartbeat?
Breathing heavier and sweating. It's all well and good to know what are our benefits and what we should do, but then the missing link is how are we actually going to do that? Your healthcare providers can just stand up all day and say, eat vegetables and exercise, but how do you do it? And so what I'm, in really examining people that are able to stay physically active versus people that don't, I've really thought about, well, what is going to make you happy with it? You know, and that whole, CrossFit and extreme intense thing. If going to a gym causes you anxiety or makes you uncomfortable or you don't enjoy it, then by all means you shouldn't do it. You have to find the thing that you're going to enjoy, because what you're going to enjoy is what you're going to stick to. So you really, if you're trying to incorporate physical activity into your life, you've got to examine, other than the health benefits, what am I looking to get out of this? You might be somebody that works a high stress job where you're around people all the time, but really on the inside, you're a lone wolf and you just don't like being around people. Then maybe swimming might work really well because you're underwater and no one can bother you. That might be, or you might be somebody that works kind of a solo job, or, you live alone and you don't have a lot of contact and you really would rather be around more people. So maybe some type of club team sport, soccer or basketball or something where you can interact with other people. Or you might be somebody that, takes passion to drive you to do something, and you're looking at something cause-based. I assume that the large majority of us have some relationship to cancer here, whether it was ourselves or a family member or a friend. And there's different things like organizations like Team in Training, where people all join together and they do bike races or marathons or things like that to raise funds. Team in Training is for the Lymphoma and Leukemia Society. So maybe that's the sort of thing you're looking for, something that's going to inspire and drive you. So just kind of look around at all your different options and look for, are you a lone wolf? Do you need to do it alone? Do you like to do it alone? Then you've really got to dig in your discipline. But if you want it to be a social thing as well as exercise, then you join a team somewhere, or one of these, the breast cancer 3-day walk, something like that, where it's a charity organization and you can engage with other people and really just enjoy your time together while achieving that exercise you're looking for. So
I'm sorry to ask you to repeat. Of the 3 things, there was heartbeat and sweating. What was the second?
Breathing harder. Yes.
Breathing what?
Breathing harder than you are at rest.
Thank you.
You're welcome. Let's see. Another point here on risk reduction. So I know everybody probably came in here like, okay, we're going to get the answer to the question. We should eat organic or we shouldn't. And again, I just don't know that I can give you. So, and actually, it does not really addressed anywhere about, barrier to organic, right? I think the number one barrier is cost. I would say that's the number one barrier to everybody. Sometimes also there can be availability barriers, but here again, we're really fortunate. We have like the best produce in the world in Northern California. We're really, really lucky to live here. But that cost is that big barrier. And then we're looking at, well, we want to be eating lots of fruits and vegetables, lots of whole plant food. But if I'm going to eat more of it and have to pay more for it, that can be really sort of challenging. It is absolutely better from the point of your overall health profile and cancer risk reduction to eat 5 servings of conventional fruit and vegetable in a day than only 2 servings of organic. Absolutely, when I'm thinking about and when talking to patients about the benefits of fruits and vegetables, I really kind of leave organic out until they want to discuss it. My thing more is total quantity. And, and I just threw that 5 servings out there, but ideally we're all eating about, depending on our body size, 3 to 4 servings of vegetables a day and 2 to 3 servings of fruit a day. And when I say a serving, that's basically, it's about a half a cup or roughly what fits in your palm. So it's something that's absolutely achievable, while, it can be intimidating to think 4 servings of vegetables. A lot of times, if you look back to that, that on that plate there, you've got at least 2 servings right there alone. So again, the total volume, when we're looking at our fruits and vegetables, what do we need to be doing? Total volume, eating a lot, eating plenty of them, and then variety. You want to have as many different things as possible. A lot of the different nutrients that may exist in one fruit or veggie that don't exist in another, they combine together and they have a synergistic effect that's a lot stronger than just the individual nutrient alone. So you want a lot of variety. You basically want to try to eat fruit and vegetable for every crayon on the crayon box. You want to hit all those different colors and get a wide variety there. So definitely better to be having more overall, even if you're not able to necessarily afford or access that much that's organic alone. My next bullet is a point I preach all the time. don't let perfect be the enemy of good. If you're thinking, well, organic's probably better and this is really something I want to do, but I can't eat all of my fruit or vegetable organic, eating some of it is better than none at all. Even if it's just, oh, wow, so fruits and vegetables are good, and that guy said that you have like 3 veggies and 2 fruits a day, and I just can't do that, but I could do 2 and 1. That's better than none. So, never letting perfect be the enemy of good when it comes to our health outcomes. We have a strong idea of what the best thing is to do, and we're all just on a journey trying to get there. If you think that I eat 4 servings of veggies and 3 servings of fruit every day, it doesn't happen every day. I try. The fruit's a lot easier than the veggies, and I try, but trying and working towards that direction is the big benefit for our health. Again, when considering an organic budget, and we only afford so much organic food, plant proteins, eating a lot of beans and nuts and seeds and tofu, organic versions of those are a lot cheaper than getting organic, grass-fed, free-range meat. And we're also, as we remember from those prevention recommendations, we want to scale back on our meat consumption. So we can stretch our organic budget out a lot if we're doing plant-based proteins. There are different initiatives people have tried, like Meatless Mondays, or say, go vegetarian 1 day a week. I'm not here to convince anyone to become a vegetarian, but depending on how much meat you consume, it might be beneficial to reduce and start thinking about using these other plant-based foods as your protein sources. That way, those are a lot cheaper. You've got extra money where you can spend for that organic cut of beef, whereas before that was kind of out of price range.
So, I don't hear good things about soy. I can't really tell you why, except I stopped eating tofu because I don't know, is it the organic versus
It's the estrogen. I mean, for a breast cancer person,
Yeah.
it's the estrogen.
Yeah, so we've got questions coming out about soy, hearing not good things about soy or the estrogen content. That's a whole nother presentation that we could give, but I want to give you a quick bullet on that. And even AICR's recommendations now are saying that 2 to 3 servings a day of whole soy foods are considered safe.
Of whole what?
Whole soy foods. And so by whole soy foods, what I'm getting into there would be tofu, edamame, soy milk, tempeh, anything that's using the actual whole soybean. What we still have some cautionary concern against would be soy extracts, soy isoflavins in extracted form, some of these isolated soy protein powders. Those is kind of like still some muddy waters. But there was a long time, there's a lot of concern, soy and breast cancer risk relating to the estrogens. Now, soy has what are called phytoestrogens, plant estrogens. That is different than human estrogen. There's no human estrogen in food anywhere. Human estrogen is only made endogenously inside the own human body. The AICR's research they're sort of trending in the area. Again, this is a muddy space to say, the research is looking like, but it's not conclusive. Maybe soy or the phytoestrogens might actually even be protective against an estrogen responsive breast cancer risk, because having those plant estrogens coming in may be suppressing the body's own production of estrogen. Again, it's a dicey area that we're not 100% sure. I have the confidence from what I've read in research and literature that, again, these whole soy foods, to have a few servings a day is okay. But again, it's not the be-all and end-all of the world. Soy for a while was the silver bullet food that was going to make us all have no heart disease, and we were all going to be the healthiest people ever. And then it's like, oh, wait a second. Again, that magic food doesn't exist. There are great properties to soy. It can be included in a diet in a wonderful way. If you're concerned, if you're a breast cancer survivor in breast cancer treatment and you're worried about it, you don't have to have it in your diet either, and you can still absolutely have a very nutritious diet without it. So it's like everything else. It can have a role, but if for any number of reasons it doesn't work for you, there are plenty of other foods to fill in those gaps. Yeah. But again, so that point again about the plant proteins is just kind of thinking that, and again, even throw tofu and soy out the window and you've still got all these different types of beans, garbanzo beans, kidney beans, black beans, navy beans. You've got all of your different nuts. Again, California, our walnuts. I'm from New Jersey. I grew up hating walnuts because the only walnuts I ever had was the Blue Diamond bag that sat up in the cupboard, and it came out every year at Christmas for fruitcake. Well, like I ate the same walnuts and fruitcake, and I hated fruitcake. But I would dig in there because I'd always be like behind my parents' back, like I'm hungry and I'm looking for something. And it's like this bag of walnuts is 6 years old and it only comes out to make fruitcake. So they've gone rancid. Of course they taste horrible. And then you come here to California and you go to the farmer's market and they're like, yeah, we picked this crop yesterday. And it's like one of the most delicious tasting things. So again, we have a bounty of different plant-based protein options that can then, they're cheaper. And then you can buy more organic meat. My last bullet here, beware of organic junk food. There is organic soda, fruit snacks, or gummy bears, candy, ice cream, you name it. Everything's available in an organic version. And if you're not thinking about it, like organic is your code word for healthy, and you're like, oh yeah, it's organic, so it's good for me. It's soda. Just like having those 12,000 calories of organic apples, like, oh. Everything good in a balance and a moderation. And if it purports to be a food, but you look at it and you have no idea where it could be from in nature, whether it's organic or not, it's not a great choice for you. An apple comes from a tree. And we know where that comes from in nature. That's a good thing. A can of soda does not grow on a tree. Like that's your kind of key there that, And again, if you eat a wonderful diet and once a month you have a soda, not the end of the world. You drink 3 or more sodas a day, it's not going to be good for you. So just kind of be on the lookout for that stuff. Yes?
How about gluten or carby foods?
Yeah, so question about gluten and carby foods. So 2 separate issues there. One, gluten, huge fad now. Gluten is being blamed for everything from celiac disease, which it does have an actual implication with, and anyone with celiac disease needs to avoid gluten for their health. It's also being blamed for World War I, World War II, the Civil War, and everything else. There's really, but again, what does data and research actually show? So the thing about gluten, though, and I've seen a lot of people, they go on a gluten-free diet and they're like, I lost weight. So it must be the gluten. Was it the gluten or was it all the junk food that we eat with gluten in it? Gluten is a naturally occurring protein in wheat, barley, and rye, in 3 different grains. The people that go on a gluten-free diet and then lose weight, they're probably not cutting out bulgur wheat, that's cracked whole grain wheat. It's a really nutritious, wonderful food, staple in a lot of Mediterranean cuisines. They're not stopping eating bulgur wheat and whole grain barley. They're not eating white bread. They're not eating the saltine crackers, burger buns, all this kind of junk food that has a lot of gluten thrown in it. They go on the gluten-free diet and they get hyper-focused and they make healthier food choices outside of all this refined, processed, added gluten food, and then they lose weight and they're like, it was always gluten, it was wrong. It's like, no, you were eating junk food that also had gluten in it. And again, relating to a cancer risk and gluten, nothing identified at this time. Carby foods, you're asking about that. So, again, I really imagine, this is my sarcasm voice coming in here, but I imagine that we're rolling into the era of protein is bad for you. I just turned 37 in July. So it should be time for the protein is bad for you, because the first 18 years of my life, it was fat that was bad for you. And fat was the cause of everything, including all of those wars that I talked about. And fat was terrible for you. And then we eliminated fat from everywhere. And then what happened? The nation only gained more and more weight. So then the next 18 years, it was carbs. And carbs were the worst thing ever for you. So I'm waiting. I'm like, when is it protein's turn to be the evil guy? Carbohydrates should be ideally actually making up about half of our calorie intake. The body, carbohydrates are the predominant fuel of the body. The problem is that we've, in our somewhat deranged food system with things like soda, or the fact that there was a survey recently and over half of respondents said they thought that chocolate milk came from brown cows. And children that think that food comes from packages, they don't realize that food either comes from a plant or it's a running around living creature. So we've got this really weird food system where carbs are cheap to produce. Cane sugar or corn syrup, that's a really cheap to produce carb. And we flood it everywhere because it lights up the sensors in our brain and makes us happy and we love the taste. Because biologically, for the millennia before we had the modern food system, concentrated sources of carbohydrates were hard to come by. So it was like this treat and this amazing thing. And now we're just throwing them back every day. So carbohydrates absolutely belong in the diet. They should be about half the calorie amount. But we're talking about carbohydrates from fruit, from vegetables. It shocks a lot of people. Carbs are evil and they're terrible and I'm not going near any sugar. And when I tell them that vegetables have sugar, they're like, no, you're wrong. And I'm like, no, they do. So absolutely we should be having carbohydrate foods in our diet, but vegetables, fruit, whole grains, not Wonder Bread, whole wheat bread or brown rice or quinoa or oatmeal or barley. Other carbohydrate sources, you get some from dairy as well, if you choose to include that or not. Beans, also another carbohydrate-rich source. So not something you need to be scared or avoid. But the refined carbohydrates, the added sugars that are being pumped into foods to make them more palatable or cheaper to produce, that's not good for us. That's the kind of stuff you want to avoid. And the really exciting thing as far as added sugars, 'cause sugar naturally occurring through fruit, vegetables, grains, totally fine. The added sugars are what we want to be avoiding. But a lot of us, like our hands are tied, we're like, I don't know what's an added sugar. And there's dozens of different names that an added sugar can be listed on an ingredients label under. The nutrition facts labels that you see on your process or in your packaged foods are now going through, they're into 3.0, their third iteration. It's not everywhere in stores yet, but I'm seeing them pop up more and more, the third one, and it actually lists added sugars on it now, where it never used to before. It would just say total carbohydrates, sugar, dietary fiber. Now it lists added sugars. So that's a good thing to know to look out for. If food doesn't have a nutrition facts label because it's something like an apple or a piece of fish that doesn't come in a package with a label, don't worry about it. Eat it. It's real food. It doesn't have a label. That's a little bit idealistic, and to be more pragmatic in our common life, we eat packaged foods. That's the world we live in. But you can be looking at them, and soon, I think by the end of the year, I think it's 2018, they'll all have to list the added sugars, and low as you can go. And it's going to be really great because it's going to force food producers. Once we identified that trans fat was a major cardiac risk, and then that got forced on the food label, all of a sudden now trans fat is almost gone from the food supply. So once the producers are forced to list it, then what can you do now? Public pressure. You call people, you can raise heck and say, why are you flooding our food with sugar? Make me something with less, and it'll happen. So that's a good thing.
When it says sugar, how much sugar? Is that just added sugar or?
So right now in the current way, so the question was, when labels say sugar, is it just added or not? No, the current labels, there's no way to differentiate between naturally occurring sugars and what is added. So in a product, in something like applesauce, we've taken apples, there's sugar in them, but that's in a great natural form and that's good for us. But then, we don't know on that label if it says X number, 30 grams of sugar, how much of it's from the apple, how much is the sugar they pumped in.
I was thinking of raisins,
Yeah.
for example.
Well, so if it's raisins and you look on the box and then you look at the ingredients and the ingredients is raisins and it says sugar, it's naturally occurring sugar that was in the grapes and is kind of concentrated down in the raisins. So you're okay. But, something like a Raisin Bran cereal, and that's another thing from my youth growing up. I remember I used to fight with my mom. I'm like, I want the Raisin Bran that has the brown sugar on the raisins. And she was like, no. And she bought, I think she just got like bran and then dumped regular raisins in there. I'm like, where's the sugar? So something like that, you can add sugar to the raisins and then they start being less beneficial to your health. So I really want to be sure to touch because we're running. Oh, was there a question though?
My question is honey.
Yeah. So honey, what's your question about honey?
I read some article that mentioned honey is good for the cancer patient if they want something sweet.
Yeah, so I don't know. So she read somewhere in an article saying honey is good for cancer patients if you want something sweet. The best thing as a cancer patient if you want something sweet is a piece of fruit. When we look at honey, so people do a lot of comparison to say honey versus molasses versus table sugar versus brown sugar. None of them is really better than another. People try to tease out these little things like, maple syrup has this mineral in it. And they're all added sugars. That even if there's a minute benefit in one versus another, you're still having the detriment of the fact that you're adding a lot of sugar into your food. So, no one sweetener is really going to be great for your health or better than another.
So I attended a lecture last night, and
that sugar feeds cancer, and that includes fruit.
And where was this lecture?
This was at the Cancer Resource Center in Palo Alto.
Okay. And who was this though? No. So the question.
And I've seen that other places
Yeah,
too.
this is a whole, I could talk to you about this until tomorrow morning and then still say, okay, I got to go to work and I'll come back and talk to you about it again. The question was about a lecture that one of our attendees here was at where they said sugar feeds cancer. That if I had $1 for every time I heard that, I wouldn't have to work anymore. That is the best way to say is that is a gross oversimplification to say that sugar feeds cancer. The term sugar encompasses many different food substances and carbohydrates that ultimately at the end of the day, all of our food breaks down into blood glucose, and that is our fuel. So it's a gross oversimplification to just say that sugar feeds cancer. And the way that I'll sort of attack it is to say, if I were put on a witness stand and said, under penalty of perjury or oath of law or whatever they tell you, and I'm picturing myself in Law and Order, and I'm up there, and the judge says, or the prosecutor says, does sugar feed cancer? My answer absolutely has to be yes, but I hope that nobody edits this and cuts that out. You've got to listen on to the whole thing. Sugar feeds every single cell in our body. Our carbohydrates predominantly break down to blood glucose. Even proteins and fat can break down into blood glucose, and that ultimately feeds every single cell in our body. We don't have a current way to be able to selectively feed certain cells in our body while starving out others, i.e. a tumor. If anyone is able to figure that out, they will have a Nobel Prize. Every single cancer center in the world will rename themselves after them, and they will be the darling of mankind. No one will talk about the Dalai Lama or the Pope anymore. They will talk about the person that figured out how to feed our healthy, non-malignant cells while starving our cancerous cells.
That idea of a ketogenic diet, ketones as a fuel source versus glucose.
Yeah, and again, that's a whole nother ball of wax that we don't necessarily have time in here. She was asking about a ketogenic diet. There is actually research studies that are going on looking at ketogenic diets for brain cancer. And there's some interesting sort of promise there, but that's, again, and looking at the time frames, we don't have time to get into that. The ultimate guidance at the end, Esther's going time. The ultimate guidance at the end of the day, get your get your sugar through fruit, vegetables, etc. I'd love to talk to that person last night that said even fruit. That is a bad idea to be telling people not to eat fruit because the sugar feeds cancer. And I would love to ask them, well, what about the vegetables then?
Vegetables, great. Plant-based diet, great.
Vegetables have sugar too, though. Gosh, I'd love to debate this guy.
He did acknowledge that, but he said fruit has a lot of sugar and that feeds cancer.
Yeah, I would love it. That'll be part 2. We'll have the debate. So to get things wrapped up, because I know Esther has a little bit more she wants to chat about, this is a great resource for you. This comes from the Environmental Working Group. This is the Dirty Dozen and the Clean 15. This is for those of us that are mystified. I've got to eat organic, but gosh darn, it's expensive. The Dirty Dozen are crops that receive large amounts of pesticide in the growing process. So that's something where you say, I've got a limited organic budget. I think that maybe for my cherries, my pears, my peaches, I'll choose organic there. Where the Clean 15, these are crops that don't need a lot of pesticide to grow. So whether they're organic or not, they, even if they're not organic, they don't get a lot of pesticide. So that might not be worth your premium organic dollar to get the kiwi, the cantaloupe, one of these. Yeah. Oh, she's taking pictures now. And there's copies of the slides everywhere.
Yeah, but you can't read it.
Oh, you guys can't read it all right now. Well, we don't. The Environmental Working Group. On the last slide with my resources or wherever, that's listed there. So you can go online and you can find it. What's that? Oh, really? Let me give you my good side. I'm going to end on this last slide here. Well, actually, there's another slide after that asks about questions, and we don't have time for questions, but we've been asking questions the whole time throughout. So this is just something that as I was struggling with my own choices of should I eat organic versus non and whatnot, and I really thought, and I kind of based this off of anyone ever remembers Maslow's hierarchy of needs from school. So thinking about your overall health, reducing your cancer risk, think about it sort of from this hierarchy of needs kind of thing. First is are you eating adequate amounts for your weight goals? That could be, you might be in cancer treatment and struggling to maintain your weight and really having a tough time. So you're thinking that you want to bring up more and be getting more calories in to keep your weight stable. You might be just a lay person with no relationship to cancer, but you know you want to lose weight to reduce your risk. So that might be eating a little bit less. So first, are we just eating enough to maintain the weight we want to be? Then the second one, are we following these different survivorship guidelines, a plant-based diet, all these other things that we want to be looking out for? And then we're maximizing that, and we're like, well, I really still want to do everything I can. Then you raise up to your next spot, and you eat more organic, and you eat more seasonal and local foods as well. And another a bullet I'll say there too, with organics, some of our local farmers markets here in California and in the Bay Area, if you ever see the words no spray, and people are saying that, that is code for, we don't use pesticides, but we couldn't afford the $10,000 that we had to pay are they listening? We couldn't afford the $10,000 or however many dollars we had to pay the USDA for organic certification. So there's gradients, and where I'm getting at with that is all of your fruits and vegetables are healthy, and there's different inputs that go into them. Did they have pesticide? How much? Are they actually certified organic? Is it local? Is it that non-organic apple that was grown in the Central Valley and got picked yesterday? Or is it an organic apple that was trucked in from Chile, or trucked and boated and flown in and has been off the tree for like 10 weeks and the nutrients are degrading? So a lot of different factors to consider. But if you're eating more fruits and vegetables at the end of the day, you're doing right. Here's our question slide, which I have to skip because I've been answering questions all the time and Esther gave me time. And here's some of the different references that are on all the slides. So that Clean 15 and that Dirty Dozen, that's that last or that last website address, the environmentalworkinggroup.org. So a lot of great things you can look up and to continue furthering your learning.
Why are local foods better?
Because exactly, they're fresher. All produce, once you pick it from the tree or pull it out of the ground, it starts to lose nutrients over time. And if it was picked or pulled locally, it's going to get in your mouth faster than if it was picked or pulled halfway around the world. Thank you guys so much. Your questions were great. I would stay, I say I would stay and talk forever, but then I'm going to get tired sooner or later. And there's an 8:17 train and a 9:17 train. And I love your questions, but I don't love them an hour later. Thank you guys.
Thank you very much.
Thank you so much. Thank you so much. Well, I just would like to mention, absolutely. I'd like to mention a few things. First, I would like to thank my colleague, I didn't introduce us earlier today, Esther Chan, who's our program manager for the Cancer Center, and I'm Darla Watanabe. I'm the director of the supportive care programs. So I would like to point out in our calendar that we create this twice a year, and so calendar of events also talks about the exercise programs that we have available. Exercise consultation going hand in hand with what Ray was talking about earlier about having, if you don't know your abilities and you'd like to have a consultation, we do have an exercise consultant that comes and talks so you can schedule an appointment. We also have nutrition one-on-one classes, or actually these are group classes that you could sign up for newly diagnosed patients, okay? So usually within the first couple of months of diagnosis, we'd like to have you come in and sit down and work with a dietitian. I'd also like to point out that on our website, we also have all the videos. As you know, today we're videotaping this one. But one of the questions that you had earlier about the sugar and whether, or actually over here, sugar and cancer, there about 2 years ago, there was a lecture on sugar and the effects of cancer. So take a look. I think there's about 30 plus videos on there that you might find of interest.
What's the URL? What's the exact
Oh,
URL?
it is on our calendar.
I want to know.
Yes.
Our
So it's
website.
www.stanfordhealthcare, all one word, .org/cancer supportive care. All right? So you can always pick up one of these and take it with you. It's on there as well. Absolutely. Absolutely. Let me see. So I also wanted to mention, too, there are several things that Ray mentioned that are really important to remember. Exercise, taking care of yourself, And we offer those programs. So please take a good look at us. We have mindfulness meditation to help you with stress reduction. We've got exercise consultations. We've got yoga that's been shown to help benefit, cancer patients as well as the caregivers. So please take advantage of those. And we want to thank you. Travel safely home, and have a good evening.